Okay, guys. So yesterday we are discussing panel coding, the very important topic, as well as we have completed chapter 8. So today we have to go with the last minor topic. The topic is medicine, right? So you guys please note down the heading is chapter 9. This is for medicine. This is for medicine. So we are receiving 6 questions from this particular topic. From this topic, we are receiving 6 questions in your exam. So one thing you guys remember, actually in your CPT book, 2 chapters the code start with 9 series, guys. One is medicine. So what we are discussing today in this particular topic, the code start with 9, and the next topic is E&M. So the E&M also the code start with 9 series. But what does the difference mean? In this E&M, the code start with 99 series actually. So the 99201, 202 like that. So this is the difference. And medicine mean the code start with 909192 like that it will be start. So this is the difference. So today we have to discuss the medicine. Actually the medicine mean we don't have any procedure or things, guys. The provider performing some extra services, those services will come under in this chapter 9. Mainly the infusion service and injection service, it's playing major role in this medicine, right? So mainly the infusion service, IV service, we are receiving 2 or 3 questions in your exam. So remaining the minor topics, we are receiving the question. So this one also minor topic only. You guys no need to prepare or mug up anything. That infusion service alone, it's a concept oriented. Based on the time calculation, we have to build. It's one of the interesting topic. So we have to discuss one by one. So the first topic from medicine, we have to discuss dialysis, guys. Right? Can anyone tell me for which condition dialysis is performed? Anyone? For which condition dialysis is performed, guys?
Chronic
Kidney
kidney disease.
Yes. So if the patient having CKD or else ESRD, for those scenario, we are using the dialysis procedure. Okay, it's very simple, guys. Please note down this. Then I have to discuss. Please note down this, guys.
Completed, sir. Completed, sir.
Okay.
Completed, sir.
Completed, sir.
Okay.
Completed.
Yes, everyone is completed. Okay. So the first topic we have to discuss dialysis, guys. So you guys already said the dialysis is a confirmative. Actually, the dialysis is a service for which condition they are performing. Mean if the patient having CKD or ESRD condition, the provider perform dialysis. So very simple, guys. You guys please concentrate. The first three digit, the dialysis code is 909, right? So the 909 is the first three digit. The fourth and fifth digit, we have to apply the concept. So first three digit is 909, and then the fourth and fifth digit, we have to apply the concept. So very simple. The fourth digit, how you have to code mean based on the procedure. So what procedure the provider perform? Based on that only the fourth digit you have to use. For example, if hemodialysis, if the provider perform mean your fourth digit is 3, and then other than hemodialysis, if the provider perform, the fourth digit is 4. So this is the difference, right? Again I repeat, the 909, the fourth digit you have to build based on procedure. So in case the provider perform hemodialysis, actually dialysis means it's a common, guys. We have a lot of procedure in that hemodialysis, peritoneal dialysis, like that. So the hemodialysis alone, if the provider documented mean your fourth digit is, we have to use the number 3. And then other than hemodialysis, any procedure the provider perform, your fourth digit you have to use number 4. So this is one. And next one, the fifth digit we have to code based on the face-to-face performance. Actually, the hemodialysis is not a one-time procedure. Based on the kidney complication, the provider order 4 time, 5 time also per month. So for example, if the provider order 3 times dialysis procedure, some of the provider, all the 3 times they have to meet the patient before doing the service. So this is called as E&M visit or face-to-face visit. Some provider only the first time they are meet the patient, remaining time they directly go for the service. So based on this only the fifth digit will be code. Only one time that E&M visit will be performing, your fifth digit you have to use the number 5, and every time they performing your fifth digit is 7. That's all, guys. So fourth digit you have to code based on the procedure, and the fifth digit you have to code based on the number of face-to-face visit. So if you guys checking these two things in your question, you are getting answer in this particular dialysis procedure, right? So 909, fourth digit, fifth digit you have to use. Okay, now I will give you one question. You guys don't tell the answer. Please given the answer in this chat. So in this question, what is your answer? Just send me in the chat. Then we will discuss. So please note down, guys. The question is, the patient have ESRD, MD order MD order peritoneal dialysis. MD order peritoneal dialysis 4 times in month. Four time in month. All the time E&M is performed. All the time E&M is performed. So you guys please send the answer in this chat. Don't tell me, please send the answer in this chat.
नहीं दी
Okay. So I'm receiving the answer from everyone. Yes. So the answer is 90947. That's all. Guys, clear? So the answer is 90947. Because the 909, this is a common one. The provider perform peritoneal dialysis catheter. So you have to use number 4 and then all the time E&M is performed. So 7. So the correct answer is 90947. That's all. So that's all about the dialysis, guys. You guys nothing have to do, just to follow these 2 steps and you have to code accordingly. That's all. Guys, clear? Okay. So this is for dialysis. And next one is the next one is the family psychotherapy, guys. So please note down this and update me, guys.
Completed, sir.
Completed, sir.
Okay. So is it everyone is completed, guys?
Yes, completed.
Okay. So family psychotherapy. So you guys don't think family psychotherapy mean the entire family psychiatric? Not like that, guys. So family psychotherapy mean in US. I hope you guys know nowadays whenever you have to go for the coding per day, we are receiving, for example, 100 charts you are coded mean. In that 100 charts, maximum 80 percentage of charts we have the psychiatric condition, right? So the reason in US the psychiatric problem will be very frequently it's happened. So normally if the provider go for any charts, like if you go with any chart, minimally if the patient having depression, stress or anxiety like that, the commonly the psychiatric condition the patient having. So if the patient having psychiatric condition mean the provider what they are doing mean they have to one day they have to schedule session for entire family along with patient. They have to discuss why it is happened, what is the stress the patient have happened. So everything they have to discuss. So this is called as family psychotherapy. So very simple, we have only two code 90846 and 847. So what is the difference between these two mean? One is the family psychotherapy treatment the provider perform with the patient. Another one is the without patient, right? In case if the provider documented I am performing the treatment with the patient mean you give 90847. In case if the provider documented without patient mean you give 90846. This is the common one. So in your question if they documented like this mean easily you code. So with the patient without patient you have to code easy manner. But actually the provider documented how they given the exam question mean whenever they started psychotherapy treatment that time the patient is present. In between the patient going out. Again I repeat guys, whenever they started treatment that time the patient is present. In between the patient is going out. Now you consider us with the patient or without patient guys. Anyone? The patient whenever started that time the patient is present. In between the patient is going out. Now what we have to do?
So with
Any idea?
patient, with patient.
Okay. So actually this question we are receiving exam guide. So always remember the entire session if the patient is present that time only you have to use with the patient. In case in between the patient is going out like that anything they documented you have to quote without patient only. Please note down guys. Clear? Whenever the patient is present that time whenever the family psychotherapy started that time the patient is present and in between the patient is going out like that anything you are receiving mean you have to use without patient code only. So don't forget this one. Clear? That's all guys. So this is for family psychotherapy. So why this type of question we are receiving mean I'm already informed. Nowadays the psychiatric condition the patient flow will be very high guys. Maybe in future we have separate speciality also for psychiatric. So that's the reason we are receiving one question in your exam from psychiatric, right? Okay. So the next one is the TEE procedure. right? The next one is the TEE procedure. So TEE mean transesophageal echocardiogram, guys, right? Transesophageal echocardiogram. This is the code for TEE, transesophageal echocardiogram. This is for TEE. Okay, so please note down, guys. In this TEE, we have two set of code. One is the congenital TEE, another one is the adult TEE. Guys, can anyone tell me what is congenital, guys? Anyone? What is congenital meaning, guys?
Genetic disorder.
Okay. Congenital mean, guys? No idea. Guys, congenital mean by birth. Actually, many of the candidate what they are thinking mean congenital mean it's a baby, children, like that they are thinking. Actually, congenital mean by birth. The patient having problem by birth, it's called as congenital. Okay, so for the TE, you have two set of codes, guys. One is the adult TE, another one is the congenital TE. Okay, so we have 6 codes, guys. I will give you one by one the description. Please note down, guys. Then we discuss. So please note down the first one is the adult, guys. Please note down adult. Okay. So in adult, one by one I will tell you, guys. Please note down. The first one is the code 93313. Please note down 93313. The description is TEE with the pro placement. So 93313 is TEE with the pro placement. Right? And next one 93314. The next one is 93314. This is for TEE with the interpretation and report. TEE with the interpretation and report. And the last one 93312 is right. 93312 is T with the pro-placement with the interpretation and report. T with the pro-placement with the interpretation and report. That's clear? That's all. So once again I repeat guys, 93313 is T with the pro-placement, 93314 is T with the interpretation report, and 93312 is T with the pro-placement and the interpretation report. Right? This is a combo. That's why I said it later. Okay. So next one is the next one is the conjunctive. Okay. So congenital also we have 3 code guys. So 933, 15, 16 and 17. Right? Okay. So 93316, please note down interpretation and report. Right? And then 17 is T with the interpretation and report. And then last one 93315 is T with the pro placement and the interpretation and report. Okay. So that's all. Right? For the congenital also same description guys. 93316 is pro placement, 93317 is interpretation report, and 15 is pro placement with the interpretation report. So this is the codes. Okay. So now you guys having all the 6 codes description you have. Okay. Now I will give you the question guys. You guys try to give me the answer for that. The question is, right, the question is, 76 years female have 76 years female have dextrocardia, 76 years female have dextrocardia MD perform TE with the pro placement. Again repeated, guys. The 76 years female have dextrocardia. MD perform TE with the pro placement. Right? Okay. So now you guys send me what is the answer for this. Okay. So what is the answer I'm receiving from everyone is 93313, right? Okay. So in this particular question, the correct answer is 93316, guys. Right? So this is the reason this question we are receiving frequently in your exam. So what does the main thing mean? What we are thinking, if the patient age is 18 or 19 more than that, we consider the patient is adult like that. Yeah, that is a normal term. But in this TE procedure, you guys, please don't code based on the patient age, guys. Please code based on the patient condition. Actually, the patient age is 76, okay. But the patient condition dextrocardia, this is one of the congenital condition. So we have to use the code 93316. Actually, the congenital condition, guys, the patient having problem by birth, but at any age they have to go for the treatment. 90 years or 85 age, whatever. So that time they go for the treatment. So one thing don't forget, whenever you code TE procedure, you have to code only based on the patient condition. Don't code based on the patient age. And one more thing. So in this question, the dextrocardia is the congenital condition. So you have to use 93316. Some candidate they are asking, sir, we have thousands of congenital condition is there. So how I have to know this is the adult condition and this is a congenital condition? How I have to know? Like that question they are asking, guys. So don't forget, right? One thing you guys don't forget. What does that mean? Whenever this TE procedure you guys are receiving in your exam, you guys go and check. You guys go and check the ICD book, guys, right? Because in your ICD, the code comes under Q series, mean we consider as a congenital condition. So, for example, in your question, dextrocardia, the provider given, nothing you guys will do. Directly go and check your ICD book and read the code. If the code comes under Q series, you directly code it as congenital code. In case other than Q series, anything will come, you directly give adult code. That is enough, guys. Because we have thousands of congenital conditions there, like dextrocardia, and then we have ASD, VSD, AVSD, coarctation of aorta, like that. So definitely we are not mug up all the condition because of single mark. So if you follow these tricks, you guys getting answer very easy manner. Clear? That's all. So this is for TE procedure. And the next one, you guys please note down cardiac catheterization, guys. Right? Cardiac catheterization. So this one is direct code only, just for the knowledge. You guys receiving in your exam mean easily get the answer. Cardiac catheterization. You guys don't think in medicine why we have to discuss cardiac catheterization like that. You guys please don't think, because this cardiac catheterization, some of the cardiac percutaneous procedure, it will comes under 9 series. So that's why we are receiving this. So we have 3 code, guys. Please note down. The first code is 93451. Right? The 93451, this is for right heart catheterization. Right? The first one is right heart catheterization. And next one, 93452. The 93452, this is for left heart catheterization. Left heart catheterization. And then third one, 93453. This is for combined right and left heart catheterization. Clear? Again I repeat. 93451, this is for right heart catheterization. And then 93452, this is for left heart catheterization. And then third one is 93453, this is for Combine right and leftward catheterization. That's all, guys. So these are all the topics from this medicine. But these are all the minor topics. So still we have infusion service, guys. So in our next session, the entire session we have to cover this infusion service. So it's a time-based concept. It's a very interesting one. So how much important is this topic mean? In coding, we have ED department, emergency department. In that ED department, this infusion service concept they have to use. So in our next session, we have to discuss that, right? It will be take time to complete that. So Monday, we have to discuss this infusion service. So the Monday we have completed minor topic, guys. So then we have to enter into the major topic, right? So you have to plan accordingly. So till now, whatever the topic we discussed, I have to share the assessment in your group. So in your free time, you guys please complete one by one assessment. Then only once the session done, you guys directly go for the exam. So it's very easy to plan for the exam. So if you guys complete your assessment now, right? That's all. So thank you guys. See you on Monday. Please do any assessment in this weekend. So thank you guys.
Thank you,
See you
sir.
on Monday. Happy
Thank you.
weekend.
Thank you, sir.